Take your notebooks, keep them ready. So post-fall care, Mr. George Gale.
And actually, I have done that Georgia's letter before, so I know that letter, ma'am. Ma'am, is there any individual classes, ma'am? Like, still I didn't start my speaking anything. Just 8 o'clock classes only, ma'am. I have attended.
So we are going to start the session. So here is the letter, official sample number 5, writing subtest test booklet. Yes, you must write for your answer for the writing subtest in the writing answer booklet. So all of you write in the writing answer booklet. Okay, writing answer booklet. And I want you to write in the quality check answer sheet. Just you check quality check answer sheet. I am sending you quality check answer sheet. So you better take that one and write in that quality check answer sheet. Here is quality check answer sheet. So this is quality check answer sheet with the name in that quality check. So write in this answer sheet, that is better for you. And now here it is. So with the quality check, second page and third page only you take print out. Second page and third page only you can take print out. No need to print out all the 4 pages. Take separate papers. On one page, one side only you write. Because in the exam also you'll write like that only. Same, follow the same pattern. Follow the same pattern. Right. Number 1, follow the same pattern and write. Okay, you can leave the first line and start from the second line. This is quality check paper. First page, this is second page, and this is third page. So you can write in the second and third pages. Okay, so only these 2 pages you can print out. Fine. So now let us see the question. Study the question now. Yes, mic is connected. Right. Study the question paper. So this is the first page. And this is the second page. So first page. Okay. So you can see we are starting from here. So you can study these things. We are starting from here. So next, find out which is relevant information and which is not relevant information. I'm going to explain the most important parts. I'm teaching you different and new concepts. So you'll know what the concepts are. Yes, this is not medicine, this is not nursing, this is everything. Any profession can, okay, learn, because I'm not teaching this letter, I'm teaching how to write sentences, how to write passive sentences, how to write quality structures, how to use simple sentences. We are going to learn all these things which will give you weightage. If anybody is not interested, you can just stay away from this session, because we are going to learn a lot of important things. Sharmila. Hello, Sharmila.
Yes.
Yeah, I want you to note down what I am telling, because I am thinking, I'm closing my eyes. Okay. So I want you to be my hand and write in the chat box what I am telling.
Okay.
Okay. Just write down all those things which I am telling in the chat box. Okay, we are going to learn these different things. Okay, learning new concepts. Write down. Learning new concepts. Learning new concepts. Learning new concepts. So number one, all these things should go into your letter. Whatever these points which are coming there, nobody else will write anything. Just listen. Just notice. Write down in your notebooks. Okay? Write down in your notebooks. Number one, simple sentences. Number one, simple sentences. Number one is simple sentences. Number two, complex sentences. Complex sentences. Yeah, Sharmila, you can type here in the chat box.
Yeah, I'm writing, sir. Together I should do?
Oh, no. One by one you can type. One is enough. If you write together, then it will be waste of time. Others will not follow. So number one by one, whatever one means one, two means two, like that. So you can send. Okay.
Okay, sir.
Essential components of an OET letter. Okay, she's writing now. Fine, very good. So, right. Number two. Number one is simple sentences. Number two, complex sentences. Number three, compound sentences. Compound sentences. So these are the 3 points which are very important. That means these are 3 plus things. So use these 3 things. Use the simple sentences, use complex sentences, use compound sentences. Number 4, avoid ordinary sentences. So this is the opposite. These 3 you can use, but the other one, ordinary sentences. Ordinary sentences. What are ordinary sentences and what are simple sentences? I will explain you. First, write down all of your notes. Write down the notes. Next, number 5. Write sentences in passive forms. So passive forms. Write down passive forms. Next point is passive forms. Passive forms. Number 6, avoid active forms as far as possible. AFAP means as far as possible. But sometimes you must write passive active voice only. You cannot change it into passive. That I will show you. So avoid active voice as far as possible. Avoid active voice as far as possible. Next one. Use markers and connectors. Use markers and connectors. Markers, pointers, connectors. Markers, write separate points. Markers, connectors, pointers. The next one, conjunctions. 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 So you have to use conjunctions. These conjunctions are of 2 types: coordinating conjunctions and subordinating conjunctions. Write down coordinating conjunctions, subordinating conjunctions. I am showing you what is quality. How can you get A grade? There are many students who got A grade. Okay, how can you use conjunctions? Coordinating conjunctions and subordinating conjunctions. Then next one. Next one is use relevant information only. Now, what is relevant information? I'll tell you. Use relevant information only. Next one. Avoid irrelevant information. The opposite of it. Avoid irrelevant information. Next one. Organization of the letter. Organization of the letter. Next one, type of letter. Type of letter. What type of letter it is? What type of letter it is? Is it an urgent letter or an ordinary letter? So urgent letter or ordinary letter? Others, write in your notebooks. Urgent letter or ordinary letter? Next one. Referral, discharge, transfer. Referral, discharge, transfer. Passing on information, that means information letter. Information letter. Information letter. Okay. Right. Next one is known or unknown case. Known or unknown case. What is it? Okay. So now this is how you are going to next components. First one will be number one. Components. These are called the components. Number one will be, write down, number one will be address. First you have to write the address. 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 Then next one. Address will be in 5 parts. So name, number one, name. Name. Number two, designation. Designation. Number three, facility. Number four, street or town. Number 5, state or country. So these are 5 things there. Next one you will have the date. Next one will be the date. Yeah, date will be in 3 parts. Number 1 will be the date. 1 digit or 2 digits, both are okay. Next one will be the month in words. Month should be written. Many people will write in a month in number. Don't write. Nowhere in the official sample you will write month in, for example, 3/8/2022. If you write, is it 3rd of August or 8th of March? We don't know. We'll get confused because in different countries, different styles are there. So be careful. So better avoid writing the name of the month in digits. Write the name of the month in words. So that is always better, safe side. Next one, year. Write in full, 4 digits. Year should be in 4 digits. Year should be in 4 digits. Remember that. Then next one will be number 3. That is salutation. 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 So salutation will be there. Then after salutation, there will be regarding line, subject line. Regarding line, subject line. I'm going to tell you many things, sir. Okay. Most of them you know, but still you are doing mistakes. You don't know that. So next one. Next one will be the body of the letter. The body will be 5 paragraphs. Write in 5 paragraphs. Many people will write 4 paragraphs only. Okay, write in 5 paragraphs. And in the first paragraph and last paragraph, don't write the main points. Okay. The central points don't write. In the introduction, you have to write the extraordinary points, not just main points, extraordinary points. Okay. And the last paragraph also extraordinary points. And in the middle, you write ordinary, normal things. Okay, the main story. Right. So in urgent letter, you will write today's visit. In other letters, you will write normal. So, next one. So So first paragraph will be introduction, last paragraph will be conclusion. They will be identical but in a different style. And then do not use note form. Use expanded form. He's telling here, but many people say PRN. Okay, BD. They write PRN, BD. And they write ASAP. So like that. Okay, that is wrong. Okay, BP. Why do you want to write BP? BP is note form. Say blood pressure, na? You're writing a letter. Why do you want to use notes? Okay, right? So as far as possible. So don't write UTI. Write urinary tract infection. Like that. Okay. And next point is don't use the information which is given in the letter. So for example, normal is there. Then you can use unremarkable. Unremarkable. So use some words, different words from the case notes. Okay. Right. So here single episode, single occurrence. So use different words. This will show that you are talented. You are not copy paste the words. You are not copy pasting the words. So like that one. So now fine. Let us see here now. Yeah, that is fine. I've given you some basic points. Now we are going to the letter. Now let us see what are important points. Address. So first one, address will be here. So it is Miss Jane Gold. Yeah. Don't write Miss Gold. Write Miss Jane Gold. Okay. Write Miss Jane Gold. Second line, this is called designation, head nurse. Next, Primrose Nursing Home. This is facility. 3 Blackwood Street. This is the street. This is the town. Yes, come on. So this is how you are going to do. This is how you are going to write. So this is the address. 5 lines you have to write. You have to write 5 lines. Yeah. Now how you will write? Okay. Okay. Yeah. 5 lines. So now what you have to do is you go to quality check answer sheet and second page. There, leave 1 line and no, they're not going to punish you for leaving 1 line. Okay. So here, you paste it. You write here. Yes. So 5 lines you have to use. So remove comma. So that's it. Then next, head nurse. Primrose Nursing Home. 3 Blackwood Street. Old Town. So that's it. This is how you have to write. This is how you have to write. There is some order in writing. Then what you do, leave 1 line here. Every time you change, leave 1 line. Don't write anything there. Then next, okay, leave 1 line. Next, yeah, next one, you know, it is date. So you should know this is the last, ready for a discharge here. So that is very important. So you have to underline. So this is ready for discharge. Discharge, she is ready for discharge, 15th May 2021. Okay. And she is being discharged, okay, to the nursing home or what? Right there to head nurse at nursing home regarding further care. So now let us see here. Assume that today's date is 15 May 2021. So today's date, you are writing the letter on this date. Is it the same day or not? You check. 15 May 2021. So if it is the same day, that means you are writing, see, this is discharge date. 15 May 2021 is discharge date. But this is today's date. So there are two different things. Discharge date is different and today's date is different. So both are totally different things. If this today's date is 15th May 2021 and discharge date is 16th May 2021, that means she will be discharged tomorrow. Here today's date is 15 May 2021. Write like this only, don't write 505. Then discharge date also is 15 May 2021. It is the same day. So what are you supposed to do here? So just copy and write that one. So now let us see here. Here it is, 15 May 2021. That's it. Now again you have to leave one line. Again you have to leave one line. Okay. Now that is so simple as that. Fine, that is address. Then next one. Next one is what you are going to write. So to whom you are going to write. That is salutation. That is this one. Miss Jane Gold. So you are writing to her. So here we are going to write here and we'll say dear Miss Gold. Second name you will take. So that is it. Dear Miss Gold. Dear Miss Gold. Okay. Dear Miss Gold. So leave one line in between everything. So that's it. Fine. Dear Miss Gold. So here, Miss and Gold. And you'll write dear in the beginning. You will not lose any marks. Instead, you will get quality marks. Okay. So all the 5 things are important. Name, designation, facility, street, and city or town, whatever it is. Next here, regarding line. So you are writing, okay, regarding line. Regarding whom? That is what it is. So colon immediately. No space before colon. Now after colon there is space. Regarding. Now regarding whom? Where to find the information I am showing you? Relevant information, correct information. So you are writing regarding George Gale, Mr. So George Gale, Mr. Copy as it is. Sometimes when you are writing, many people are doing spelling mistakes. So Mr. George Gale. Mr. George Gale, comma, space. And now, date of birth is given and age is given. When both are given, you can write anything. Okay? You can write date of birth or you can write age. So how you can write DOB 24 April 19, don't write APR, write APRIL, or write 85, aged 85, both are right. Both are right. So both are right, any one you can write. So date of birth, colon, okay, date of birth, colon, space, 24 April 1936. This is one way of writing. And other way of writing is, instead of 24th April, you can say, comma, aged 85. So this also you can write, any one you can write. This is in brackets. Okay, brackets means you can remove that one and you can write this one. That is the meaning. Both options are there. You can write that one or you can write this one, any one. Both are correct. Both are correct. Then next. Yeah. So that's it. So these are the four things. Right. Number 1, 2, 3, 4. Now again, you will have 5 paragraphs. You will have 5 paragraphs, and your letter will come till here in the second paragraph. So you close your 5 paragraphs till here. Here better. So 1, 2, 3, 4, 5 lines in the second page, or maximum 6 lines. So 1, 2, 3, 4, 5, 6. Okay. Don't write here. This is finished. Next here, the 6th part. Yours sincerely. Because you know you are writing to a person with a name. You are not writing to just a nurse. You are writing, or you are not writing to a doctor. You are writing to a person. Miss Jane Gold, not just a head nurse. We know the name also. We know the name also. So you sincerely. If we don't know the name, that is Miss Jane Gold, then you have to write yours faithfully. Yours faithfully. Okay. So that is it. So here the name Miss Gold is there. If it is a dear nurse, then you have to write yours faithfully. Okay. Now second page, till here you will go 5, 6 lines. Then you hear yours sincerely. So that means you have to write till here in the second page at least. Okay. 200 words. And this is yours sincerely. Then leave another line. Okay. Then afterwards. Right now, so we got it. From where we got, you know everything. Then next one, last one is your address. So you are a nurse and you are in the Old Town Hospital. You are a nurse. You are in the Old Town Hospital. And here you are admitted. He is admitted. So in the ward. So it's in the ward now. Okay, post-operative ward maybe. Right? Or some other ward, intensive ward, or else inpatient ward. So you can write all these things. You are a nurse. So you are a charge nurse, ward nurse. So you are taking care of him in the ward. Ward nurse or charge nurse or registered nurse. So inpatient ward, because admitted. The admitted is the word here, inpatient ward. You are in the inpatient ward. You have to write these things, no? That is what is your knowledge. It's common sense. Everything is there. Many people just write nurse and doctor and leave it. You're writing a letter or what? You know, that's why many people will not reach even 400. Okay, they say nobody is writing. So nobody is writing. So what is your problem? You write, no? Nobody is writing passive voice. So you write, no? So next. So here they are there. So nurse. So write registered nurse. Then, so next one. Right. Yeah, we'll see that the recent updates we'll see now. No worry. We'll just see those recent. There are many things. I'll update that to you. So next one, when we are writing the letter. So 4 different things here you are going to write. So first one is registered nurse. Okay. So like this. If your name is also given, write the name also, registered nurse. So this may be inpatient because he is admitted. Inpatient ward. Inpatient ward. Okay. And the name of the hospital is Old Town Hospital. Old Town Hospital is the name of the hospital in Old Town. That's it. In Old Town. Okay. Old Town is here, you see. So Old Town. And if your name, sometimes they'll give you are Margaret Thatcher or you are Abraham Lincoln, a nurse in old. So that one also you have to write. So 5 things will come here. So these things will come here. So these are nothing. You can just go ahead and you can write these things. Okay. So here. Systematically you write everything. See, when I am putting everything is on the line. So that means how much practice I would have done so that everything will come to maintain that in same line. If I increase the font or decrease the font, automatically it will go offside. See, one down, up like that. So we have managed in such a way that it is on the line. See here, write like that neatly, everything. That's it. So these are the concepts which I am telling you. These are the concepts which I tell. There are many things which you have learned, many new things which I have told you. Okay, follow all these points. Follow all these points. This is part A. This is part A of writing. This is part A of writing. I am not teaching any letter. I told you already. I am not teaching any letter. I am teaching you parts of letters. What goes where? Components of the letter. Now I want to ask you. Okay. I am asking you one question. Did you learn anything new here? If it is yes, say yes. Even 1 point you learned new, means say yes. Okay. If 1 point, at least 1 point you learned something new, say yes. That's it. If you did not learn anything new, everything is old, say no. That's it. No problem in that. That means you're excellent. No worry at all. No worry at all. So how to present it in a neat fashion, beautifully, systematically. Okay. Right. And here you have to leave 2 lines. Sorry, I forgot to tell you. Here you have to leave 2 lines. Why 2 lines? In every official letter also you see there will be 2 lines left. I'll tell you why. I'll give you the reason. Nobody will tell you. They'll just tell how to write a letter, and that is simple. There are some things, sir, okay, which are very important. I'll show you the same letter. I'll show you the same letter. See here, very carefully. I'm taking you to the letter, sample letter. See here, sample letter. See there, how many lines are left? If you can see this, you can understand what I am talking. I'm not talking nonsense. See here, how much gap is there? Here, how much gap is there? Not only this letter, take any letter. Take any letter. Okay. There will be 2 lines. You know why? Normally 1 line will be there. And next signature will be there. And name of the nurse will be there. So 2 lines must you have to leave. 2 lines. So that the signature can be there here. Before nurse. And there will be 1 letter space like this. So this signature in hand. Okay. Signature in hand. Right. So remember that. That's very important. 2 lines. Then many people write different styles. See here, what is he telling? Letter. Yeah, see here. See 5 lines. 5 lines. Okay. Then see here. May is written in words. Many people don't write. They write 15, 3, 20, 21. Don't write. That is not accepted. That is not official format. So follow all these things. So many students said, yes, we have learned something new. Right. So that is it. Okay. That is the session. So now this is the first part of the letter Gale. Okay. Then afterwards, after today, now we have the reading lecture at 8 o'clock. We are going to have reading lecture now. I'll be sending the link for reading lecture. So you'll be joining there. Now we are going to discontinue and we'll be joining there for reading session. So after the reading session, I'll give you writing part 2. That is the most important thing, and don't miss. There was one girl who told, now, sir, I already wrote this letter, sir. That means she is very perfect. She doesn't want to learn anything new in this letter. Simon sir is telling, and you are writing, is there any difference or not? You have written, no problem. Simon sir is explaining, will there be any difference or not? Definitely there will be difference. That is your style, and this is an expert's style. That is a student's style. This is a teacher's style. So when teacher is telling, come, he is inviting for a session, just join. Okay, just join. Because you learn something new. Definitely you learn something new. And you will learn all those mistakes which you have written. You will realize how many mistakes you have written there. Because you have already written. Now you know. You can realize that, oh, sir is telling this. Then, oh, I did like this. So that is wrong. You will realize that you made a mistake. So that is why at least you have to come. At least for that reason, you have to come. Right. So that is very, very important. That is very, very important. So the second part of the session. Now I'm asking you one more question. Okay. Was this session useful? Was this session useful? You know, many things you know, but still the organization, how you are writing, from where, what you have to select. Okay. How many lines you have to write, everything you have learned. So never do any mistake, because if you write all these things properly, you will get an additional 30 marks, correct if it is. If you miss any one, you will lose 10 marks. Okay. Don't think that you are going to get these marks. For example, if you don't leave 2 lines space, here. Okay. At the last. That is important. That is a rule. Here. See here, single line. Here, 2 lines. That is important. Okay. So, complete thing you have to write, whatever it is. So, now next question is, how many of you are willing? I am writing the question. Afterwards, you have to say, those only I will notice. How many of you are willing to attend the second session? Okay, write down. Then I will tell you the timing. I'm giving you 15 seconds. After the reading session, we'll join. After the reading session, you can say yes. Okay. Second session. After I'll see how many people there. Then only I will send the link. Right. Yes. So, right. So we got these many students. Now let us see. Fine. What is that? Timing. So now 8 o'clock we are going to start the reading session, and our second session will be 11. Okay, 2300 hours. No, 2200 hours. Sorry. 2200 hours. That means exactly after 2 hours. Okay, 10 minutes, 7 minutes less. IST, Indian Standard Time, means from now, count it up. 10 minutes. And I'm going to lock the door. I'm going to lock the door. Once I start the lecture, I lock the door. That means nobody can join. Okay, from the beginning, begin. Because some people will come in the middle. I don't want. Okay, latecomers, I don't want. Because that is going to be a very special lecture. One of its kinds of lecture. So try to attend, all of you. Right. So I'm going to send you a new link. Those who are registered for, those who have paid 1,000 and registered for reading sessions, and those who have taken registered regular session personalized with me, and those who have joined for 1 month course or full course, all of you can join that session. Okay. And those who attended this particular session now, if you are new also, you can attend. Okay. Even if you are a guest also, you can attend. But for today, because these sessions are every day, these people have paid 1,000 and they are attending every day the sessions, morning, afternoon and evening. Lot of sessions, the techniques, the skills. Okay. So that is it. New link will be provided. Now I am asking you. So you are going to join that session now, and we are meeting in just 10 minutes. I'm sending you the new link. So you can give your feedback here. 30 seconds time I am leaving you. So what difference this particular lecture gave you? What new things you have learned? For example, that you have to write 5 lines in the address. Okay, so you learned that there are 7 components. Okay, so these things you can learn. Whatever you learned, you can just write. Just 30 seconds, I'll keep them there, and I'm going to send you the new link in 10 minutes time. Schedule meeting. Yeah, immediately it will come. So this is reading day 2. Okay. Yeah, evening batch. Regular students. Regular registered students only. Okay. Those who are coming now, they can attend one day to know the difference, what we are learning. Yes. And if anybody is interested, yeah, there are 3 or 4 places. I told you, those places you can fill also if you want. Yes. Come on, write down whatever you want to write, you can write down. Timing is 8. Okay. Fine. Now we are going to start. We are not waiting till 8:30. It will go to maybe 1 hour or 2 hours or even 3 hours. I don't know, because once I step into the lecture, we'll go off. Right. Show, mute, automatically record. Yes. Save. Then copy invitation. Copy invitation. Copy meeting invitation. Okay, those who want to join can directly join from here. Telegram, I'm opening it in the Telegram channel. I'm putting in the link in the Telegram channel. Okay, there, this is the link. Now I have put reading link, reading lecture, not started, but you can go and join there. Reading lecture commences, because don't wait for the WhatsApp, because there are many WhatsApp groups. I don't know. So you can directly join from him, disconnect from here and join there directly. Right. Yeah. Select all. See. Yeah. Fine. So I'm